Alright, this is my fourth vlog for this semester. I just finished my clinicals and I'm going to answer some questions. One complete clinical semester behind you, one more to go. How do you feel? I feel pretty good. It's hard to believe that we finished a clinical semester already. I definitely have learned a lot from my preceptors, and I feel a little overwhelmed because I know it's going to be a lot different at the hospital than it was at the surgery center, because the cases are going to be a lot more challenging, and just I feel like I'm not going to be used to it compared to the surgery center. But so far I feel fine, like good. I feel like I've accomplished a lot just with one semester. Rate yourself from 1 to 10, with 1 being very low skill and 10 being ready to graduate and kill it on the field. I would say I'm anywhere between a 5 and a 6. I'm definitely not a 10. I feel like I won't ever be a 10 until I've worked in the field for a few years. But I'm getting there. Just taking it day by day. I mean, I wouldn't say I'm low skill, because that would be more like first semester when I didn't know any of the stuff we're supposed to do at first. But it was definitely helpful having these clinicals, because I feel like I've learned so much with this experience. Talk about your journey from the first week until now. What cases do you feel strong in, and where do you think you need more work? Definitely the easy cases I feel strong in. I worked with Dr. Sneed in a lot of eyelid surgeries, and it got to the point my preceptor wouldn't even scrub in. None of them do for those, because there's such an easy setup, and he's a very self-sufficient surgeon. So most of the time I'm just sitting there suctioning the smoke plume coming from the bovie and loading up his suture for him and handing him that. And that was pretty much it. And also I feel pretty good about TNAs. Those are pretty easy to do. I know my first week I walked in and I was like shaky and really nervous, and then after a few weeks just felt kind of comfortable and I got used to it. So I'm not as nervous as I was my first week going in. I mean, I still get a little bit nervous when it comes to passing instruments. I don't know why, but the surgeons are very intimidating to me, especially when they're really tall. I definitely need more work in passing instruments confidently. I've said that in a lot of my videos, but there are times, sometimes I'm getting better at it, but then there's times I'm like, he'll say an instrument and they talk very quietly sometimes, so it's hard to hear what instrument they want. Or sometimes I won't know what that instrument is, so I'll just grab one and kind of hand it to him. Yeah, but I also need more work too with, like, a lot of the ortho cases are very hard, like the knee arthroscopies and elbow arthroscopies and ACL ones. Definitely need a lot more work with those and setting them up. And I know the hospital probably won't have a fast setup time, but the surgery center, that was another hard thing, is like getting your table set up and everything ready in such a fast amount of time. So definitely those are some things I need to work more in. And also with a lot of my preceptors told me that I need to learn to not just move things all over the place multiple times. Like, I need to pick it up and put it down and not touch it again. They keep telling me I should only touch everything once to put it in its place, and it's hard for me to do that. What has been your favorite part of this clinical rotation and your least favorite portion? My favorite part is getting to work with a bunch of different preceptors and kind of learning their ways and them giving us different tips. They were very helpful. I liked a lot of the preceptors I had. I think there's only two that I kind of had an issue with, but thank goodness I didn't work with them much. I think I worked with each of them twice, so it wasn't that big of a deal. But definitely learning their technique and getting some advice from them. Then my least favorite part was when they would tell us, oh yeah, you can set it up however way you want. And then after we set it up, they're like, oh, you won't need this or this or this. And like they change it up to their style. So it's like, okay. And I know there's been times I'll put an instrument on the Mayo stand, and then they'll see it and they'll be like, "Oh, you don't need that instrument on there." And then we go up to the table during the surgery, and the surgeon will say, "Hey, where's that instrument?" Like, I think I was in a TNA recently, and from when I've done TNAs in the past, we've always had a herd dissector on the Mayo stand, and the preceptor, who I've never worked with before, she was telling me that, oh, you don't need that in your Mayo stand. Like, he'll never use it. And then we went up there and he was asking for it, so we had to grab it, and then the rest of the day I just kept putting it up there because he used it every single time. So I thought that was kind of funny, but it just gets kind of frustrating when they tell you to set it up your way and then they change it up, and yeah. And also it kind of gets confusing when you work with the surgeon and you learn his technique, and then you don't work with that surgeon for weeks later, and then when you do work with that surgeon again and that same preceptor, they'll think you know exactly how to set it up and what instrument's going to come right after the other. And I'm like, I've worked with so many surgeons, I can't keep track of what instrumentation comes right after the other. It's hard. So I'd say that was my least favorite part, just the fact that they'd expect you to remember everything even if you only worked with that surgeon once. Where's your confidence level at? I would say it's on a scale of 1 to 10. I would say about a 6. I'm still not confident with my instrumentation because they call it different things from what we've been learning in the book. Because I know in septoplasty surgery, there's these one scissors, and from what we learned in the book, they were like an Adson tonsil Schnitt scissors, I think. But they call it the night scissors, so just knowing what they mean by instrumentation sometimes. Because we learn it as a different name than what they say it is. But definitely with passing instrumentation, I need to work on my confidence level for that. What is something you're dying to conquer? I'm wanting to conquer definitely probably my confidence level, like just being more confident in doing things, and like also I've been told by a few preceptors like I need to initiate more, like be more initiative. So I'm going to work on that. That's definitely something I want to conquer. What are your expectations going into semester 2? Definitely bigger cases, since I'll be at the hospital. It'll be a lot more traumas, heart surgeries. So definitely step my game up. It's going to be different because I think they count their instruments probably since it's bigger cases, and so that's going to be something new because I'm so used to, like, at the surgery center just counting the sponges and your needles and blades and hypos and bovie tips. And yeah. What case are you waiting to see in your next rotation? I really want to see like brain surgery. I think that'd be interesting to see, because I know I have a lot of patients who've had TBIs, which are traumatic brain injuries, and had craniotomies, and it's just like interesting to see what the surgeons do for that. And also it'd be awesome to see another open heart surgery and actually being up there helping out with it. That'd be fun to see. Did you meet your goals, change them for the semester? I have not met my goals at all. I know in the beginning, a lot of it was on my confidence with passing instrumentation. But I'm working on it. I'm getting better. So that's a bonus. I think in the first video I was saying about sleep, getting more sleep. That is definitely a goal that I can't work on with my work schedule. So unfortunately I'll just have to be tired. But yeah, so that's one goal that I'm not doing anymore. What are your goals heading into next semester? Next semester, I want to be more confident, definitely take more initiative with my counts and everything. So I'm always worried the nurse is too busy to count with me, and because they got their own things that they have to do, and they have to get the patient, prep them, set them up, and all that. So just be more initiative with that, and those would be my main goals for next semester.